From a physician's perspective, what have you noticed are the greatest challenges during the COVID age regarding the physical or mental health of patients, especially in minority communities?
That's a really important question because COVID has been devastating for all of us and for all of us in different ways. But it has impacted, particularly our mental health. And so, what I just mentioned about, for example, gun violence surging in Philadelphia, since the stay-at-home order, mid-March, gun violence has been up from about March 2020 until the end of last year, so December 2020, up about 40% compared to the year prior. It's crazy, 40% higher rates of gun violence in the city, and that's a direct result, in my opinion, of the increased stress that COVID has brought. And so it's mental and emotional stress, financial stress, because people have lost jobs, and that has disproportionately impacted minority communities. We all know that COVID has hit minority communities harder, both in terms of the numbers of infections and the numbers of deaths. So that in and of itself, that loss is a stressor. And when you sort of build stressor upon stressor upon stressor upon stressor, combined with the fact that in a city like Philadelphia, you already have very high rates of poverty, which in and of itself is very stressful, then what happens is something like gun violence surging. We also have seen opioid overdoses surging. For the first time in Philadelphia, in the 3 months after the stay-at-home order, more Black individuals in Philadelphia died by opioid overdose compared to white individuals, for the first time since this data has been reported over the last 10 years of the opioid epidemic. Those rates had been climbing, but they, since the pandemic, they basically have stayed flat for white people, but have gone up for Black people. And again, I think that is the result. It's the result of several factors, but one of them is the stress of the pandemic. And so I see that in the emergency department because we take care of victims of gun violence. We take care of people who overdose. It's also just the stress of having the disease. I can think of several patients, young patients, who came into the ED and had a very mild case of COVID. So, they themselves were probably going to be okay, but they would break down crying because they live in a house with, 5 other people, including their elderly grandfather, and they don't have anywhere to socially isolate in their house. And so they felt really guilty about bringing this disease home and feeling helpless, like they didn't have any way to protect their family. So there have been a lot of stresses that I've seen in the emergency department because of COVID.